This conference will now be recorded.
Namaste all. Let us start the fourth session of Shalakyasiddhi Series 2020, organized by the Association of Shalagi, Kerala chapter, and the Department of Shalakyatantra, Ashtamgam and Vidyapeedham, with a prayer. I invite Subhana for the prayer.
अनन्द संसार समुद्रधारा नौकायिताभ्यां गुरुभक्तिदाभ्यां वैराग्य साम्राज्यद पूजनाभ्यां नमो नमः श्री गुरुपादुकाभ्यां कवित्ववाराशि निशाकराभ्यां दौर्भाग्यदावाम्बुद मालिकाभ्यां दूरीकृतानम्र विभक्तिदाभ्यां नमो नमः श्री गुरुपादुकाभ्यां.
Thank you, Subhana. Vision is a gift from God, and blessed are us all who can comprehend vision. We learn to focus our eyesight since our birth, and as we grow, we need to develop skills to focus this eyesight to imbibe only the good in the world in order to attain self-realization. What more could be a happier coincidence than to have the World Eyesight Day in between this webinar? And the importance of such a coincidence lies more so when we realize this pandemic has had a toll in eyesight of all, with an increase in the use of electronic gadgets like phones. Our final year students of Ashtangam have made us all proud by acting responsible, and we appreciate the efforts they have taken to launch an awareness video. I invite all of you to watch their video for the World Eyesight Day. Thank you, dear students, for a wonderful video. Just like small drops when put together will become a big ocean, similarly, your small contributions could lead to a betterment in the world. Let us move to our session. I invite Ashwin, Assistant Professor, Department of Shalakyatantra, Ashtamgam Vidyapeedham Series and Vidyapeedham, to deliver the welcome address.
Namaste one and all. As we successfully move on to the fourth day of Shalakyasiddhi, we are extremely pleased to welcome you once again to another wonderful session. Today, we have an eminent Shalaki as our guest of honor, Dr. Jeena N.J., Professor and HOD, VPSV Ayurveda College, Kottakkal, and also the President of TAS Kerala Chapter. Madam has published several papers on international journals and also has played a key part in taking Shalakya to an international platform. On behalf of Ashtamgam Vidyapeedham and Vidyapeedham, we welcome you, ma'am. Our guest speaker today is Dr. Bijumon O C, Associate Professor, Government Ayurveda College, Thiruvananthapuram. Sir is a very familiar and well-known face of Shalakyatantra through many CMEs and workshops conducted all over India. As an ever helpful and friendly teacher, he is adored by his students. We welcome you wholeheartedly, and it is indeed our guest pleased to have you here, sir. I welcome Vaidya Prasad, sir, our beloved HOD and our constant inspiration, and my colleague Vaidya Sridevi to the session. Finally, I would like to conclude my words by welcoming all the delegates to another thought-provoking session of Shalakyasiddhi. Thank you, one and all.
Thank you, Dr. Ashwin.
Good afternoon. Can you hear me? Is it audible?
Yes, madam. Yes, ma'am, it is audible, madam.
I can hear some disturbance. Throughout the video, I heard some disturbance, so I was doubtful. So my words are clear?
Yes, ma'am. Yes, ma'am.
Okay.
Today we have with us Professor Dr. Jeena N.J., President, the Association of Shalaki, Kerala Chapter, as a guest of honor. Madam is currently working as the head of the Department of Shalakyatantra, VPSV Ayurveda College, Kottakkal, Kerala. She has done her graduation from the same college and PG from Government Ayurveda College, Trivandrum. Madam has secured her PhD from Tilak Maharashtra Vidyapeedham, Pune. Madam has 16 years of experience in UG teaching. She has to her credits not only many publications in international journals, but also the fact that she has helped spread Ayurveda internationally by being the part of international conferences in China, Thailand, and Russia, representing India many a repeated times. She is also the proud recipient of the prestigious Innovative Researcher Award by World Research Council 2019. These are to name a very few achievements of Madam, who is now the member of Board of Studies and Faculty of Ayurveda member in Kerala University of Health Sciences. I welcome you, ma'am, to speak a few words.
Thank you, Dr. Sridevi. Good afternoon, all. First of all, let me congratulate Dr. Prasad and team, Dr. Ashwin as well as Dr. Sridevi of Ashtanga Ayurveda College for taking a lead role in organizing such a wonderful webinar on Shalakyatantra in association with TAS Kerala branch. TAS means the Shalakya Specialist Association. And I hope you all had a wonderful feast of knowledge for the past few days. And today, you have already seen a video. It was prepared by your final year students. It was very wonderful, but the audio was not clear to me. That's what I told. Anyway, they took the pain to do that video on this day, that World Sight Day. So I'm happy that I could talk with you. I could talk a few words with you on this World Sight Day itself. This is observed on second Thursdays of October on every year, World Sight Day. So WHO as well as the health organizations of different countries in the world observe this day with an aim to prevent blindness. So the aim is to avoid or stop the preventable blindness. Many diseases are there, many diseases causing blindness, which can be prevented by apt interventions, by treatment or by some other modalities. So that is the specialty of this day. And I want to speak a few words about Shalakya, not too much, and about our association. That's what I intend to speak today. And Shalakya, you know, it's explained in Sushruta Uttaratantra, but it's not written by Acharya Sushruta. Maybe the core writings regarding Shalakya in Sushruta Tantra is lost or missing. The portion what is available today is added by Nagarjuna. And the Shalakya portions are not too much explained in Charaka Samhita. We get a few references only in Charaka Samhita, like Trimarmeya. And this doesn't mean that it's not important. With the now available parts of Shalakya writings itself, we can treat the Shalakya diseases in a very successful way. That explains the beauty and power of Shalakyatantra. And we all know the importance of sense organs. Different quotings are there even in our text, like Drishtischa Nashta Vivitham Jagatcha, Tamo Mayam Jayade Egarubam, and what there is importance of sight. And there are many marmas, 37 marmas in Jatrurtva. And you get another beautiful quoting like Urdhva Moola Madhakayab, that means if Moola is destroyed, the root is destroyed, then the whole tree is perished. And there are some unique or beautiful concepts in Shalakyatantra, like concept of Patyapati. It's very important, and this can be adopted while treating all other diseases of the body. And then some special concepts like Padala, Abhishenda, Drishti, etc. are also said. I am not going to those in detail. And Shalakya diseases or the treatment are not staying different from other aspects of Ayurveda. The concept is same why we look at it. But the practice regarding approaching such delicate sense organs of the body keeps Ayurvedic doctors other than Shalagis away from treating Shalakya disease. That is the truth. Actually, the graduates or other specialists of Ayurveda are little apprehensive to take or to treat Shalakya diseases because they're maybe the problem is they are dealing with the delicate sense organs of the body, so that may be the cause of this apprehension. Even though Ayurveda is an ancient system of medicine, its relevance in the field of Shalakya is increasing nowadays. We know that many diseases are more on occurrence nowadays, like computer vision syndrome, refractive errors, migraine, etc. And some areas are there where contemporary medical system fails, or where Shalakya can compete equally with the contemporary medical system. Some examples I can give, like migraine, progressive myopia, simple refractive errors, retinopathy, other retinal diseases. See, these are the areas where contemporary medical system has not got a curative treatment. So in these areas, Shalakya treatment can do wonders in my experience. And definitely this needs more development as well as publicity. And some areas like dentistry are not much developed or practiced in many areas, especially in Kerala. And one of the limitation I feel is that many diseases, even the prognosis is sadhya, the patient approaches us after trying all other systems of medicine. This also makes the treatment a little bit difficult. And coming to the association of Shalagi, this is the first specialist association formed in India in Ayurveda. It was formed in the year 2004, and this association made an address to our specialty. And it was a central organization formed in India, and nowadays state branches are coming up under this central organization. We have different state branches like Karnataka, Kerala, Rajasthan, Maharashtra, etc. And more members are joining this association each day. Post-graduation in Shalakya, that is MD or MS in Shalakya, is mandatory to join this association. And there are different accomplishments of tasks. This brings all Shalagis under one roof. That is the most important accomplishment what I have felt, so that we can exchange, we have a common platform to exchange ideas or share our wisdom. So through maybe seminars or conferences, workshops, webinars, everything. And the task does honoring of achievers. Many award winners are there. So the association do some honoring programs also. And it has instituted awards for deserving Shalagis. And there is a journal called Task Journal where we can publish articles, case reports. And this journal is also on the process of getting indexed. And the association also address our common issues to the apex body like CCIM, etc. Because there are many problems in maybe in our curriculum or syllabus or MSR or something. So all these are addressed to the apex body by the organization, and even that organization involves in legal matters pertaining maybe to the practice of Shalakya. In Maharashtra, they are doing all surgical procedures there, and legally it is permitted there. And once there was a problem, somebody went into court against this. So the association was there to take up this legal matter. And many senior members of TASK were involved in framing our curriculum and syllabus and actively organizing workshops. And state branches are also undertaking different programs like seminars, conferences, medical camps, observing of important days like today, World Sight Day. And after all, the association promotes socialization also. So these are accomplishments what I have felt about this association, and I want all the Shalakis attending this seminar, attending this webinar, to join the association And let me once again uh, wish the webinar and all the participants um, what to tell that they benefited, that they get benefited from this webinar. And today's faculty is Dr. Bijumon O C. He's a very good academician as well as clinician because I know him from my PG days itself. He's dealing Ayurveda in a practical way. Even Shalakya, he's taking the science to a practical way. So I hope you get benefited. You all will get benefited out of this webinar. And let me wish all the best to the webinar and also the participants once again. Thank you so much.
Thank you, ma'am. Thank you, ma'am, for your kind words and wishes. The intricate yet delicate sense organ ear is the major organ which helps us to socialize. We need to listen to learn to speak. We need to listen to comprehend. Though our sense organs, one over the other, have an influence on our emotions, calmness of mind can be brought about through listening to a soft music. However, with the advancement of social media and hearing, listening and all, our ears are also under stress today. On the clinical aspect too, ear can be problematic from an earache to an insect inside ear. The range is quite diverse. So, in order to equip ourselves to understand and manage ear disorders more confidently, we have the esteemed Shalagi, Dr. Bijumon O C, with us today. Dr. Bijumon O C, working as the Associate Professor, Government Ayurveda College, Trivandrum, has done his graduation from the Government Ayurveda College, Kannur, and MD from Government Ayurveda College, Trivandrum. He is a name quite familiar to us all. His soft-spoken nature, yet strong words, inculcates a sense of respectful intimacy in all who approach him, a favorite teacher among students and junior doctors. He has presented papers in various scientific sessions, CMEs, and workshops. He has also been actively participating to conduct and guide a number of clinical trainings in Shalakyatantra. Sir has influenced and inculcated a sense of confidence in many junior doctors and general practitioners. Today, we are honored to have you, sir, with us to deal with the topic differential diagnosis and management of Karna shoola. I wholeheartedly invite you, sir, to start with the session. Over to you, sir. Sir, Bijumon, sir.
Good afternoon.
Okay,
Can you
sir.
hear me?
Yes,
Okay.
sir. Yes, sir. Yes, sir.
Okay. Okay. Thank you. Thank you. That screen presenting option that is muted. Yes. Can you see the slides?
Yes, sir. Yes, sir.
Okay. Good afternoon, everybody. Today, I am very thankful to the authority of Ashtamgam Vidyapeedham for giving me an opportunity to present a paper on the topic differential diagnosis and management of Karna shoola. And I am also thankful to Dr. Gina, Madam, on behalf of TAS. Today, our topic is differential diagnosis and management of Karna shoola. And most of our participants are from the graduate level and BMS students, internship trainees, as well as junior doctors. My paper is formed in such a way that some basic clinical examination methods and diagnostic tools are explained here. Now we can move to the topic, differential diagnosis and management of. Yes.
Can you put it in the slideshow, sir?
Yes. Okay.
Yes, sir. Now it's okay. Thank you.
Before going to the topic, before going to the topic, there are so many practitioners dealing with eye, but ENT portion is not much related to, not much practicing widely in Kerala or all over India, especially in the Ayurvedic way. So before going to the major portion, I have to tell something that we studied that Darshana, Sparshana, Prashna. These are the three examination methods. Basically, we are using in Shalakya practice, especially in clinical practice. So, in graduate level or beginners, in the case of beginners, there's some peculiarity in the case of ENT practice. We should have a thorough knowledge of clinical examination, and also we have the skill in eliciting a meaningful history, and also we have we are regularly practicing or regular practice in examination of darker cavities. These are very important because according to Sushruta, a clinician should have shauryam, ashukriya, shastrasainyam, such qualities are there. So a practicing skill, a clinical examination skill, a history taking, and examination skill, all are needed for a good practitioner, especially in the case of beginner. I think in the majority of colleges, these are thoroughly they are learning. And you all heard that eyes will see what mind knows. Eyes will see what mind knows. That means we have certain ideas, certain literary backup, certain academic backup. Then only we have to examine and find out some pathologies there. We have to know normalcy. Then only we have to find an abnormal condition there. So eyes will see what mind knows. Remember this thing again. Now, actually, what is the purpose of a clinical examination? Or what is the intention of a practitioner? So when we are approaching a patient, what you are looking for? While we are examining the ear canal, we are going to discuss Karna shoola. While we are approaching a patient with the Karna shoola, what we are or you are looking in the ear canal for, or what kind of treatment you may have to initiate, or assess how severe the condition may be. And one of the important thing is refer the patient to a higher center if there is needed an expert management and for asking leading questions. So treatment is not only treatment is the only option of a practitioner, but also to assess the condition, severity of the disease, referring the patient to a higher center if needed. All are equally important in the case of a Vaidya, especially a Shalagi, because he is dealing with special sense organs. See, here I am going to show a slide, a picture, a slide. This is a case. See, a 5-year-old child coming to the OP with severe pain ear with history of URI, that means upper respiratory tract infection and fever. Okay, 5-year-old child coming to OP with severe pain ear with the history of URI and fever. In our private practice or clinical practice, there's a lot of cases, especially at the time of night, midnight. Mothers come with their children crying with mild fever and severe pain here in this area. Not so little children, not specifically this area. There's pain, intense pain, and the child is crying. But asking, there is a history of fever. What is the condition? Can you guess what is the condition? Actually, if it is a clinical class, I will ask a question to each one separately. But can you guess this one? Yes, this is the case. Then look, this is while while we are such a case, then the next thing is we are taking an otoscope. I will show the picture later. We will take an otoscope, a simple device, otoscope, or simple torchlight. We examine the ear canal and we can see a tympanic membrane. This is actually tympanic membrane that there is starts congestion and retraction, and also already answers there. That is ASOM. Okay, so this is a case of ASOM. What is the purpose of this slide is, for this simple diagnosis, we need two things. That is a history taking skill. In certain cases, history is very important. And one another thing is the Anatomy is also very important in the case of practicing ENT, darker cavities examination like that. And these two things, examination skill and knowledge of anatomy of detailed structure, all internal structures related to our special sense organs like ear, nose, throat, and also history is also relevant in practicing Shalakyatantra. See, I am going to explain some slides. This all you know. I am not going to explain all this anatomy like this, but here there is a tragus here. Tragus, not the juniors or students. Tragus, we are going to deal with tragal sign extra. So this is tragus, fully tragus I am mentioning here. Also, Karna shoola, then the Sharira sthana or Sharira of Karna is very important. See, middle ear is here, and two cavities or two canals are there. External auditory canal from pinna to the tympanic membrane, there is external auditory canal. From the middle ear to the nasopharynx, there is eustachian tube. So I am not going to explain all the anatomical features here, but only thing is there are two major srotases, external auditory canal and eustachian tube is there. This and also a middle ear in between, a six-sided box like middle ear having three boards like that. So a development of a Karna shoola or developing a Karna shoola in majority of cases pertain to these srotases. A pathology that deal with the external auditory canal or eustachian tube will lead to, in majority of cases, a Karna shoola. That we will explain later. Okay, can you follow me? Hello?
Yes.
Okay. Another point we have to discuss before going to the pathologies, that is a term middle ear cleft, because that is dealing with the Karna shoola also. Middle ear cleft. Here it is. There is middle ear. Middle ear has two connections in medial side and lateral side. Middle ear is connected to nasopharynx by eustachian tube, and also posteriorly it is connected to mastoid air cells or mastoid bone or mastoid air cells through additors. So this is also very important. We will discuss about middle ear cleft and pathologies later. So along with the anatomy of the ear, middle ear cleft is very important for an ENT specialist, because many of the diseases at the second stage of complication level is there is some pathologies in middle ear. Okay, so we will later explain middle ear. So we are approaching a patient having Karna shoola. We should have certain minimum settings, otherwise we can't diagnose or differential diagnose a case of Karna shoola. So I think all of you are familiar with these things. Junior, if there is BMS junior students, they are also familiar with these things. The first one is, we are going to examine deeper cavities. Ear is a cavity, eye there is a whole iris and cavity, nose is also a cavity, throat also a cavity. So we are going to examine a cavity or anatomical canal. So we should have a torch or a light source with us. For that purpose, we are using simply a torch. It is very important. In any multi-specialty hospital itself, a doctor should have a torch for a source of light. Second one is a head mirror to project light from a. The fourth one is a bullseye lamp. Bullseye lamp. From the light from the bullseye lamp, we are directed to the ear canal by a head mirror. And combined form of this head mirror and bullseye lamp, that is a self-illuminating lamp. The third one. And the fourth one is very essential. I am often compelling my BM students to purchase an otoscope. The fourth one, it is essential for clinical practice, not only for specialty practice also, but in general practice also. Otoscope is very important. The fourth one, otoscope. And fifth one is Jobson's probe. Jobson's probe. In many cases of ear pathologies, we need a Jobson's probe to examine the ear canal for taking wax out or to mop the ear canal pus like that thing. So that is Jobson's horn probe. Here in this slide also some pictures are there. The first one is crocodile forceps or Hartmann forceps. For a practitioner of ENT, we should have the instrument Hartmann forceps, because there are so many cases of foreign body ear like that. Foreign body ear. Some people came with as there cotton there or paper pieces inside the canal, or some creatures or ant like that inside the ear canal and foreign body ear. We have to take out the foreign body using very simple in using this crocodile forceps. And the second one, that is tuning fork, it is not much used in pain management, using for assessing the hearing. Okay, and the third one I am not going to explain here. And fourth one, you see the fourth one, it is suction apparatus. It's a tabletop or simple tabletop suction apparatus. We are using that because we studied in Karna Roga, that is in Karna, there's a group of disease in having pain, another group of disease having discharge, and another group of disease having hearing loss like that symptom. So three groups of diseases are there in ear. So in majority of diseases except Bhadidya like that, discharge is there, even it is pain or other karna or it is Pudikana like that, discharge or collection of pus or water discharge is there in ear canal. So for achushana purpose, according to Sushruta, achushana for suction, for clearing that or dry for clearing that, or suction clearance is used. So suction apparatus is used for suction clearance of pus like that things. Okay, these are the minimum requirements we need in Shalakya OPD or for the diagnosis or differential diagnosis of Shalakya or ENT ear cases. Okay, and one more slide is while approaching a patient. First, Darshana Parisha, what we inspect. In the case of pain, we look for the shape and size of pinna. Okay, normally we know normal size and shape of pinna. Any abnormalities in size and shape of pinna, is it bulged out or pull out like that? And any pre-auricular sinus or pits are there, it will also lead to pain. Okay, any evidence of trauma to the pinna, injuries like that, and skin condition over the pinna and external ear. In majority cases, you heard about some cases like ulpada, that means perichondritis like conditions, inflammation of pinna, sometimes gangrene is there, red colored inflamed pinna is there, so skin condition over pinna and tenderness over there, and finally that is then post-oral and pre-auricular condition also we are assessing. Okay, so these are the basic approach towards a patient. And the major examination, not advanced one, what we are doing is otoscopy examination. See the picture of an otoscopy examination. We can purchase an otoscope from the market, and with a little 1 or 2 batteries, we can operate it simply, and we can see up to the tympanic membrane with an otoscope. One important point is see how he hold the pinna. How he hold the pinna. The ear canal, as you know, ear canal is not a straight canal. It is somewhat S-shaped canal. So we have to straighten the ear canal for a direct view to the tympanic membrane. So we have to pull the tympanic membrane upwards, backwards, and laterally for straightening the ear canal in the case of adults. For children, we have to pull it backwards and downwards for straightening the ear canal. Then only we can see directly up to the tympanic membrane, even with an otoscope. Okay. One more thing is, in majority of cases of Karna shoola, the patients are children, young children, and they see the picture how to hold the children for examination. Otherwise, we are using an otoscope or we are using a sharp probe like that things. And if the children is moving like that, then that instrument will cause its own injury to the ear canal. So hold the children like this position in the along with the parent. Okay. Yes. Going to the topic, Karna shoola. You all know what is Karna shoola and studied a lot of references in Ashtanga Hridaya and Sushruta Samhita related to Karna shoola. In modern terms, it is known as otalgia. And while comparing in classical literature and Dhingra ENT, that's modern book, that is Dhingra, we are commonly practicing reading in our BMS classes. While comparing the Ashtanga Hridaya and Dhingra modern book, we can see it is at the same but different only in the language. One is written in Sanskrit, the other thing is in English, but the content and approach and medication, everything has similarity in this topic. So we can use Karna shoola as otalgia. It is right, Karna shoola is otalgia. So While we are going to Shushuda opinion, there is only one Karna shoola in explained, but here in treatment he divided into many. According to Vagbhata, there is Vadika, Paitika, Kapaja, Rektaja, Sanivadika shoola. That I am going to explain. See, by the nature of pain, it is symptomatology and pain and associated complaints. Severe pain is there, Vegavat, occasional and some Vega like pain, severe pain. That conditions we will discuss later, and a little discharge at the time of Bhagavastha in Vadika Karna shoola. Okay. But in Pitta type of Karna shoola, Paitya Karna shoola, but there is burning sensation and sharp pain is there. Along with that, laterally there is yellow discharge. But there is a Mandaruja, dull pain and itching, edema and thick white discharge in the case of Kafaja shoola. And in Dept shoola, there is similarity with the Pitta and some history of trauma is there. And extreme pain, raised temperature, fever and complications are there in the case of Sandivadiga Karna shoola. So the type of pain and associated complaints, considering these things, we can classify the pain into Vadiga, Paitiga, Kapaja, Rektaja and Sannivadiga. The main feature is pain and some associated complaints also there. So then the involved dosha can be, we can find out the involved dosha. Okay. Before we are studying in ENT, eye diseases, ear diseases, nose, throat disease, all that. But how can we consider symptoms? Study symptoms is its onset, duration, progression, and severity. Whether it is pain or discharge or associated complaints, its onset, sudden or sharp, duration, progression, severity. We are discussing these things along with pain in next slide. Okay. Otalgia. Hello, can you hear?
Yes, sir.
Hello.
Yes,
Speed കൂടുതലാണോ? Speed കൂടുതലാണോ?
ഇല്ല sir, കുഴപ്പമില്ല.
Okay. Okay. Otalgia. Now we are going to some modern concepts on otalgia here. See, pain. If there is pain in ear, if there is pain ear, it is a common condition. It is not a rare condition. Pain ear. ലൈഫിൽ ഒരിക്കലെങ്കിലും പെയിൻ ഇയർ ഇല്ലാത്തവർ ഉണ്ടാവില്ല. ഓക്കെ, സോ ഇറ്റ്സ് എ കോമൺ കണ്ടീഷൻ, പെയിൻ ഇയർ. If there is a pain, there is a cause. According to Acharya Sushruta, he mentioned that not in the context of Kaya Jilsa, not in the context of Sutasana, in the context of Shalakya Prakarana, Sushruta mentioned that famous quotation. Which quotation? That is, in Aubadravigam chapter, Sushruta mentions a quotation: Nidana Parivarjanam, Samkshevada Kriya Yogo, Nidana Parivarjanam. Samkshevada Kriya Yogo, Nidana Parivarjanam. He explained this quotation in the context of Aubadravigam chapter of Ashtamgam Vidyapeedham. So it's in the beginning of Shalakyatantra portion. So in the case of Shalakya cases, in the case of pain here, definitely there will be a cause, and the removal of that cause is the treatment. Differentiate the cause. That is the purpose of our slide. Okay. So local causes. In the case of otalgia, there is pain originating from the ear is there, pain not originating from the ear is there. The autogenic otalgia is there. So local causes, external causes, and causes of external ear and causes of middle ear. And one thing is, generally in clinical practice, pain ear, the majority of causes are situated in external ear or middle ear only, not from the internal ear like that. Okay. So that is autogenic ear pain, causes of ear pain. Here, this is non-autogenic. See, some referred causes. If we have a pain in the tooth, if you are toothache, or some ulcers in the tongue, or some problem without pharynx or larynx, then sometimes they complain about pain here in the ear canal also. That is called as referred causes of ear pain, that we discuss detailed later. And also some cases of psychogenic pains are there. They need history taking like that. Okay, but local causes, that is external ear and mid ear, and there is referred causes. Now we can move to next slide. This is a picture of a very simple test, a very simple test. While the patient complaining of pain ear, before just overall examination or just external ear examination, just touch the tragus or just pressing the tragus with a finger, patient said, there is the pain is there. By moving the by pressing the tragus or moving the pinna, it is known as tragal sign. Tragal sign. What is the intention of this slide is tragal sign is positive if the cause of the ear pain is in external ear only. So we can differentiate the causes of pain whether it is originated from the external ear or from the middle ear by tragus sign. If pain is there while pressing the tragus, it is very clear that the cause of the pain is situated or the pathology is situated in external ear, that is the ear canal to up to tympanic membrane, the ear canal. That may be a pharyngeal touches. We can see the next slide. See, in majority of cases, tragus sign positive or patient complaining of pain in ear and tenderness is there while pressing the tragus area, then the causes are pharyngeal. We will discuss pharyngeal later. That's a pedaga or that's an abscess forming pharyngeal. We will discuss later. Second one is the commonest OP complaint, that is impacted wax. And third one is otitis externa, general otitis externa. And fourth one is otomycosis, that means mycosis, fungal infection of the ear canal. And rare cases, meningitis bullosa, inflammation of tympanic membrane, herpes zoster virus infection, malignant neoplasms. So local causes are there, that is external ear, then we have to elicit tragal sign, which is positive in causes pertaining to external ear. Yes. What are the major pathologies related to local causes of middle ear? If the cause of ear pain is situated in middle ear, that may be ASOM, that means acute suppurative otitis media, acute suppurative otitis media. And associated with that or separately, that is ET, that is eustachian tube obstruction. You know, the middle ear is connected to the nasopharynx by eustachian tube. Sometimes there is a tubal blockage that will cause pain in the ear. That is eustachian tube blockage. And some advanced cases, there is mastoiditis too. In such cases, these are related to the nasopharyngeal pathology. So a history of cold, rhinitis, URI, recurrent allergy, etc. should be, we should ask for the patient for a history of such diseases to elicit or to find out any middle ear pathologies are there. So local causes of middle ear, ASIM, eustachian tube obstruction, mastoiditis. Some other rare causes are there, extradural abscess, aerotitis media, carcinoma middle ear also. Okay. So in the case of ASIM, that's what we have to find out. In the we will discuss ASIM later, but in the case of ASIM, there is a clinical test known as Valsalva maneuver. This is actually, the slide is intended for BMS students. Valsalva maneuver. What is Valsalva maneuver? Yes, in the case of ASIM or diseases of eustachian tube, the movement of tympanic membrane is restricted or arrested. Tympanic membrane movement is arrested. So ask the patient to pinch his nose, close his nose and close his mouth, after taking a breath. Then ask him to blow out or to swallow. Like examining the ear canal with an otoscope, we have to see whether his tympanic membrane is moving or not. If his tympanic membrane is not mobile, actually our tympanic membrane is mobile. When the sound rays are coming, hit on the tympanic membrane, or the tympanic membrane is movable. If it is not mobile, then at the time of Valsalva maneuver, then there's a pathology in the middle ear. So tympanic membrane is the mirror for the middle ear. If middle ear pathology is there, tympanic membrane is not movable, its color is changed, congestion is there, like that. Okay. In the case of ASIM, we have to know Valsalva maneuver. Then we can diagnose whether it is a middle ear pathology or external ear pathology. We are not going in detail about referred causes because it is actually a theory portion. It's very actually in this time of around 3:45. It's very difficult to hear such things. So for the BMS students, we have to just know the referred causes. What is referred causes? The same cranial nerve, the same cranial nerve branch supplying ear at the same time another area of the body. So a pain that area will also feel in the ear also. That is known as referred causes. The major one is dental pain. You know, fifth cranial trigeminal auriculotemporal branch. If there is caries tooth and severe pain is there, through the trigeminal auriculotemporal branch, the patient complaining of pain in the ear also. But the pathology is there in dental. Okay. Similarly, oral cavity diseases and osteoarthritis of temporomandibular joint. That's a common complaint in OP. Patients complaining about ear pain, but actually the lesion is not in the ear. It is on tympanic, TM joint. Yes. And sphenopalatine neuralgia. That is temporomandibular joint. Temporomandibular joint lesions. Arthritis. The pain is there, but patient complaining pain in ear canal. Okay. That's the referred pain through fifth cranial nerve. Next one is ninth cranial nerve. You know, glossopharyngeal nerve. Okay, that's a tympanic branch of glossopharynx. Okay, and in children, some children also there is acute tonsillitis there. Quinsy. What is quinsy? Quinsy means peritonsillar abscess. If tonsillitis is there, it's complication. Peritonsillar abscess like that. Some children complain not pain in the throat, but complaining of pain in the ear. So not only we are examining the ear canal or middle ear, but at the same time, especially in the case of children, we have to examine the associated areas like this: oropharynx, base of tongue, and also one more cases. It's very interesting case, that's elongated styloid process. We all studied a styloid process, mastoid process here, styloid process just below that. And in some patients, genetically, styloid process has some elongation, elongated styloid process. Yes, it's known as myalgia or eagle syndrome. It's a BM students, we are training not only for the clinical training, but also for PG entrance also. So that is known as eagle syndrome, myalgia. Okay, here in this picture, it is in this X-ray, it is clear that there is elongated styloid process under that the bone. It is also clear the styloid process is elongated. Here also the patient complaining of some pain in the area or around the ear, but actual cause is the elongation of styloid process. It is clear in a view of X-ray, that is X-ray Townes view. X-ray Townes view. It is an angled anteroposterior view. Angled anteroposterior view, Townes view of X-ray. It is clear that the elongated styloid process is there. X-ray is an important. Actually, CT and MRI is there, but X-ray in some cases, X-ray is very important investigation in ENT purposes. Such cases also nowadays itself, in the case of sinusitis also, X-ray is very relevant. In which view we are taking X-ray in sinusitis? Can anybody answer? The view of X-ray in sinusitis. In the cases of sinusitis, we are writing X-ray. Yes. Yes.
X-ray PNS Waters view.
Yes. Yes, it's very good, very good, sir. It is X-ray PNS Waters view. Certain views are very important. I intend these slides for BMS to students to be X-ray Waters view. It is an X-ray of PNS Waters view. X-ray Townes view is helpful for diagnosing myalgia or eagle syndrome. Okay, then it's a rare case, but I have some cases in past week, so I included this slide here. Eagle syndrome. Okay, actually it is surgical, something like that. And one more thing, referred causes 10th nerve vagus. It's very important. There's a branch of vagus nerve also in the ear, auricular branch. Why it is important? That is, you all have an experience that why inserting some buds like that in the ear canal for a long time, or we are attempting to take wax like that for a long time repeatedly in the ear canal, the patient start to cough. The patient start to cough. While we ourselves are doing some buds itself in ear canal, we start to cough after some time. It is due to the stimulation of auricular branch. A complete auricular, 1 minute. Yes. A continuous stimulation of vagus will lead to some vagus stimulation, and that will lead to some unconsciousness like that. So very careful about dealing a manipulation of ear canal. It's a controlled manipulation is also advised. So vagus auricular branch also separated in the ear canal. So if there is an ulcerative lesion of vallecula, epiglottis, larynx like that, patient complaining of pain in the ear also. So now we are discussed. In the previous slides we discussed some local causes are there and some Referred causes are there. Local causes we can easily find out by a simple examination of otoscope, Valsalva maneuver, tag a sign like that. Okay, now moving to the next slide. One more referred causes is there, that is cervical, especially in the case of middle-aged, above 40, 50, 60-year-old people came about some pain around ear. But the actual complaint is cervical spondylosis, spine injuries, carry spine like that. X-ray is very helpful. This is a Shalya case also. Actually, patient complaining of pain, ear canal, but actual cause is there in cervical region through C2, C3 spinal nerves. Okay. It is a short, in short, I think all of you understand what I told. One more thing is, rarely some patients complaining about ear pain without actual causes, and a detailed history and medical history or medicine history while we are checking the prescriptions. There is a psychological involvement is there. So history taking is very important. Okay. So in such way, we can differentiate pain or site of pain, nature of pain like that. Some more points are there. You have to know one thing. Karna shoola. We have to know some more things. That is, if the pain is sudden pain is there, especially in the case of middle-aged men or above middle age, sudden pain is there, definitely it is chance for pharyngulosis, or in the case of children, it's an ASOM or a trauma to the ear canal itself. Okay, sudden pain, pharyngulosis, ASOM trauma. We studied about the sudden or throbbing intense pain in the case of Vadiga, Karna shoola. Severe pain, ASOM like that things, there is sudden pain, less secretions in first stage. So it is Vadiga shoola, we can call it the ASOM like that. So sudden pain. Next one is gradual pain. In the case of otitis externa, that's ear canal inflammations. Like if we are seborrheic dermatitis or dandruff, there is ear inflammation is there. Sometimes there is diffuse inflammation is there. So in such cases of otitis externa, there is gradual pain. Okay. And in the case of ASOM, the pain is short duration severe pain in the case of ASOM and perichondritis. But in the case of a development of a malignancy, there is long duration pain. Okay. This is actually very important because if there is a wax is there, the patient complaining about impacted wax or otitis media like that, we have studied Kafacha Karna shoola. We studied Kafacha Karna shoola. That way, some oozing is there, some sofa is there, dull pain is there. So in eczematous conditions and otitis externa, all these things we can correlate with Kafacha Karna shoola, dull pain in such cases. And I think I told sharp pain, that is pharyngulosis, and throbbing pain in ASOM, acute suppurative otitis media. So from such classification, we can adopt the treatment from Vadiga Karna shoola, Paithya Karna shoola like that. If it's a sharp pain with burning sensation, definitely there's pitta involvement. So pharyngulosis, we can conclude it is a Paithya disease with the Visarpa Chigilsa is adoptable there. If it is a throbbing pain, severe throbbing pain, in starting of ASOM, we can adopt some Sweda procedures and some medical preparations for Vadiga Karna shoola like that. And oozing like there's oozing and dull pain, we can start Kafacha Karna shoola treatment. So nature of pain is very important to assess. In some cases, suddenly the pain relieves. And you have studied ASOM in acute suppurative otitis medium. After the tympanic membrane ruptured and pus oozes out from the middle ear, then suddenly the pain relieves. So the patient will come to the OPD after 3 or 4 days of the disease. He said sometimes the pus come out and pain relieve. Then definitely the case is acute suppurative otitis media. That's a relieving factor. And in some cases there is an aggravating, which is very important. Aggravate the nature of pain, aggravating factors. In some cases of swallowing, when patients swallow, the pain increases due to the eustachian tube movement, opening and closure. In ASOM also, not only ASOM, but also in TM joint arthritis too. And yawning, chewing like that conditions. Pain increasing in TM joint arthritis and pharyngulosis. And while pulling I already told that is track sign in otitis externa. Okay. and radiating pain. It's also very important. So we're discussing all types of pain, its type, nature, etc. If we have a pharyngeal in anterior canal wall, the pain radiates to preauricular region. Preauricular region. If the pharyngeal is situated in posterior wall, pain radiates to mastoid region. There is mastoid, sometimes mastoid edema like that. Okay. Now we just move to another topic, that is discharge, because in Karna, along with Karna shoola, Acharya mentioned discharge also. So we have to just discuss what are the types of discharge, its peculiarity like that. See, is in whether it is mucoid or mucopurulent. Thick discharge, yellow, red colored first discharge in CSOM and mastoiditis, Karna, that is pitta involvement is there. In serous watery discharge at the initial stage of ASOM, and serosanguinous in otitis externa. And if sometimes there is watery discharge, we studied Karnasrava like that, CSF otorrhea like that, otorrhea, CSF otorrhea. It's a rare case, CSF otorrhea. We know CSF in the brain inside meninges, but CSF otorrhea, CSF rhinorrhea, it's a rare case. I'm not going to explain here. One more thing. We up to this slide we studied the type of pain, the site of pain. How can we differentiate the site of pain, the nature of the pain, the discharges like that? One more slide is that in sometimes the site of origin of pain is not the ear. It is due to preauricular lymphadenitis. Some people have some lymph node enlargement before the pinna, preauricular lymphadenitis, in which it is due to, yes, the most common cause of preauricular lymphadenitis is the drainage of lymph. Yes, it is viral conjunctivitis. Okay, in viral conjunctivitis like conditions, there is preauricular lymphadenitis. In some cases, there is pain in the posterior to the ear, post-auricular due to post-auricular lymphadenitis. The common condition is inflammatory conditions of scalp like that, some scalp problems, some infected seborrheic dermatitis like that conditions. There is post-auricular lymphadenitis. And I already mentioned TM joint or temporomandibular joint osteoarthritis. There's tenderness over TM joint and pain while moving TM joint. Okay. And another one is mastoiditis. One more topic. It is something up to an extent it's a complicated one. Mastoiditis. You all know where is mastoid. Behind the ear there is a mastoid bone. First of all, I would like to ask one question. Where is the ear situated? For the BAM students, actually I am asking frequently the question, where is the ear situated? In which bone? Can anybody answer? Actually, we are studying. Yes? Not clear. Hello?
Temporal.
Yes. Okay, sir. It's a temporal. We are studying about ear associated structures, mastoid, all these things, but the base is temporal bone. So studying temporal bone is very interesting. It's a shapeless, complicated osteum, and that bone is very interesting to study. And there's a one part is mastoid part. There is a 3-finger test to test mastoiditis. What is 3-finger test? In the case of mastoiditis also there is severe pain, and we have to differentiate mastoiditis. There's a test known as 3-finger test. See, this is a case of acute, there's a mastoiditis, a case of mastoiditis. Okay. 3-finger test. It is nothing but pressing 3 points. If there is tenderness, it is due to the pathologies of various parts of mastoid. By holding the fingers, 3 fingers like this, and the middle finger is applied to the like this. Middle finger is applied to the inside the ear canal, that is Simba conge. If there is pain, inflammation is on mastoid antrum. And index finger is applied over the mastoid process. If there is pain, the majority of cases there is mastoid emissary vein thrombosis. And the thumb is pressed on the mastoid tip. If there is pain and edema, definitely there is mastoiditis. In the case of CSOM or ASOM and unsafe otitis media, like that conditions, there is a chance for mastoiditis. So mastoid tenderness should be elicited, and it's very essential, otherwise it will lead to complications. So just remember 3-finger test for mastoiditis. Okay, then up to this slide we discussed about various types of Karna shoola and it's modern types. It's autologic origin, non-autologic origin. Referred causes are there. Mastocytitis is there. Pre-auricular lymphadenitis, post-auricular lymphadenitis, TM joint inflammation. All the things we covered. Are you? I think you are clear with the causes of ear pain. Okay, are you clear?
Yes, sir.
Okay, now we are moving to the next topic. Our second topic, our topic is differential diagnosis of Karna shoola and its management. Now we are going to the management. I am explaining the classical Ayurvedic management I am adopting in my college, Government Ayurvedic College Trivandrum. It's a PG and PhD institute. There we are doing some procedures in Karnataka. Separate department is there. So Karna shoola is known as otalgia. And Acharya mentioned in according to Acharya, Nidana Parivarjanam. I explained Nidana Parivarjanam is Chilsa. While reading the classics, while reading Ashtanga Hridaya, Sangraha, Sushruta, all the classics, Acharya mentioned certain similarities, other treatment similarities. Pradishaya Chilsa can be adopted here, or Vadavyadi Chilsa can be adopted here. In some cases, there is Shofakna medicines, in some cases, Vranahara medicines, in some cases, Jwarakna medicines. And also, Vranahara, Nadi Vrana Chilsa also is there, and Vidradi Visaraspa Chilsa also can be adopted here, and Slava Chilsa can be done. So, what are these things? We can discuss. One more thing is very important, that is Samprapti Vikatana Meva Chilsa. There are stepwise progression of the many diseases in the ear canal, because there is a starting as a pharyngeal, then localized edema, then diffuse edema, diffuse otitis externa, then it will be complete loss, complete damage is there. Similarly, in the ASIM, in the case of ASIM, there is tubal blockage, then pus formation, drainage, Pudigarna. So correct intervention in the Kriya Kala. A correct intervention in the Kriya Kala can block the disease. That is known as Samprapti Vikatanam. It is very important in the case of ENT practice. See? Yes, the first case we are discussing is very simple one. Can you guess this condition in the ear canal?
Wax impact.
Yes, it is. It is an otoscopic view of in the external auditory canal. Otoscopic view of, or view with the torchlight external auditory canal. There is the wax is filled. This is a very small, simple disease, but causing very severe problem with the patient. Even he has some hearing loss itself due to this conductive deafness. So it is a wax, impacted wax. Diagnosis of impacted wax is very simple. Only purpose is, or a physician should have the mentality to examine each ear. Or just writing a prescription, it's not the right way. Examine, not going to blind prescriptions. First, especially in the case of special sense organs like eye, ear, nose, like that, an examination is important. Otherwise, there will be a wrong diagnosis, and that there will be complications also. So this is an impacted wax. Impacted wax. In the case of impacted wax, Acharya clearly mentioned that the disease is named as Karna Godhaga by Susudacharya, and according to Vagbada, the major symptom is blockage of ear. So he explained it as Karna Pradinaha. Okay, so Karna Pradinaha or Karna Godhaga. What we are going to do? Simply, yes, we studied Sneha Sweda Vishodayel. We have to, in the primary prescription, we have to advise some prescription of medicine to liquefy the wax. In commonly, we are using Kshara Thaila or Eranda Shigloy Thaila or any Thaila preparation without too much water content. The Thaila that we are using for Siropenga, we can use as for Karna Purana in the ear canal for 5 days. So we are writing Kshara Thaila Karna Purana or instilling Kshara Thaila 5 drops in each Karna or that affected Karna for 5 days. After 5 days, the patient come back and we will remove the wax. Yes, wax removal. It's a trained procedure, but a graduate student itself, after a successful completion of internship, he can remove a wax with the help of some minor instruments. Along with the Karna Purna, we are advising Karna Ubari Sweda also. At the time of Karna Purna, some oil get heat with the water or like that, then apply over this thing and just for fermentation also. So Sneh Sweda Vishodayal, wax removal. And complaint is not obsession only. The patient also at the same time, patient has pain is there. So we have to use some anti-inflammatory analgesic drugs there in various stages, various districts, various states, various medicines are practiced In Trivandrum, we are using some Gugulu preparations and Abrotram Punanavadi Kashayam for pain removal. Punanavadi Kashayam, Abrotram Kashayam 90 ml BD, and Gugulu, especially in the case of Kaishwara Gugulu or Trifila Gugulu, 2 BD for 5 days to minimize the pain also. So this is the approach towards impacted wax or Karna Bhutaka. Okay, this what the picture shows, the syringe, oral syringe, or we are using a 50 ml syringe and cannula is that is needed. Only a 50 ml syringe or cannula can be used for removal of wax. Filling the syringe with Kavoshna, Trifala Jala or Araguda Kashaya. Kavoshna, mild hot Trifala Jala or Araguda Kashaya. Araguda Toya. It's better to use Araguda Toya or Trifala Toya and push the water to the ear canal, and we can take the wax out, or we can remove the wax with a Jobson's Horne probe. We are using the probe Jobson's Horne probe. Okay, this is the procedure why we are taking out the wax, or this is the procedure of syringing. Okay, it's clear. I take in it's a need regular clinical practice. So a successful internship or after post graduation, it's very easy to do a wax removal. Another case we are going to discuss is, can anybody diagnose this condition?
Automycosis.
Yes, it is a case of automycosis. Automycosis means fungal infection of ear canal. Can we easily diagnose this condition with an otoscope? Pardon, it's not clear for. Okay, it's automycosis. Okay, automycosis. I think somebody is talking there. It's not clear for me. Okay, this is automycosis. Here, fungal spores can be seen in the ear canal. Fungal spores can be seen in the ear canal. Automycosis. At the first stage in automycosis, yes, automycosis. Yes. In the first stage of how can we differentiate a pain of automycosis or discharge from other pains? Okay, in the case of automycosis, initially patient complaining of some watery discharge with a smell, along with intense itching also there. Intense itching, watery discharge with a musty odor. Then after the inflammation starts, pain starts, the spores become inflamed in that area, and there's chance for discharge. That discharge is creamy white in nature. In some cases, it's black also. There are two main types of fungus are the Candida albicans and Aspergillus niger. One is white, the other is black. And the later stages, the deposits in the ear canal can be seen as a wet paper-like appearance. We can see like a wet paper is like a wet paper. The discharge is lying there like a wet paper. This is the case of automycosis, and what we are doing is, I already mentioned about suction apparatus. We should have clear the ear canal, dry mopping. We can use a cotton bud with our Jobson's probe, and also we can do suction clearance with suction apparatus, and that wipe that area pramachanam with Ksharadailam. And also in our department or in all over Kerala or in India, we are practicing Karna Dhuban or Karna Dhubhanam. For Dhubana purpose, we are using Gugulu or Haridravarti. Actually, Gugulu paste become paste and like a varti in a cloth, and Dhubhanam can be done on Karna. Only 5 days is needed. For 5 days, we are giving these procedures, suction and dry mopping, Karna Pramarchanam with Sharadairam, Karna Dhubhanam with Gugule and Haridravarti. Along with that, we have to need some medicines for the fungal infection, that are Araghada or Trifala Kashaya Prakshalanam. Acharya Susudha mentioned this thing, that's Prakshalanam or Dhavanam or Prakshalanam with Araghada Toya or Trifala Kashaya, and Guluchadi Kwadam or Punadavadi Kwadam or Panchadiktagam Kwadam, or Manjishtadi also inside internally, and some anti-inflammatory analgesic drugs like Kaishwara Uguru we can prescribe. Here one special thing is, Acharya mentioned in chronic pus-like conditions to reduce inflammation and itching, Acharya mentioned a special medicine, that is Pijuvarti or ear pack. We are doing in Trivandrum, we are doing ear pack for 3 to 5 days, 3 to 5 days for automycosis. How can we pack ear? We can pack ear with a piece of gauze and a ear packing forceps like Hartmann forceps. Okay. And the medicine over the Varti is Surasati Phanidam. It is mentioned in Ashtanga Hridaya, Surasati Phanidam. Phanidam is a preparation like cream. We studied that reference. Khwadadinam Punapakwad Ghanatvam va Rasakriya. Rasakriya like preparations. Concentrated Khwada foam mixed with honey, and that paste is applied over a gauze piece, gauze Varti, and insert in the ear pack for 2 to 5 days or to 7 days. Surasati Phanidam in the case of automycosis, and it's can easily curable, and we can clear this thing easily. Okay, that is the management of automycosis, Karna Kandu or Karna Strava. We can correlate with Karna Kandu or Strava. Actually, there is no need of correlation. Acharya mentioned all disease, named all disease according to the symptom developed. We can easily find out similar symptoms in the modern medicine also. Yes, another one. Yes, can anybody diagnose this condition? House surgeons?
Furunculosis.
Yes, it is furunculosis. It's furunculosis. Okay, it is an oral furunculosis. All of you know furunculosis is furuncle. Furuncle is inflammation of the hair follicle. We know our external auditory canal has a cartilaginous part and a bony part. The outer cartilage part is cartilaginous part. In cartilaginous part, there is a lot of hairs are there, and in the hair follicle, if there is a staphylococcus infection, furuncle develops. But one thing is very important: if a furuncle suddenly starts for a middle-aged woman like that, we should have examined his blood picture. There is the diabetes like that also we can check. And in the case of furuncle, there is irrespective of it's very small in size. Irrespective of its size, the pain is extreme pain is there. Okay, Granapagam or Vidradi like pain is there. Okay, furunculosis, a condition in our OPD, we can easily manage like Vidradi. Okay, staphylococcus infection of the hair follicle seen in the cartilaginous part. There is extreme painful. Enlarged, it's even it is it enlarged and tender periorbital lymph nodes also there. Okay, we can check for DM in acute some cases. Majority cases in a middle-aged or above man, we have to check his blood picture for any diabetes or not. Yes, what will it say? Furuncle. We studied in Shalakyatantra Vidradi Chikitsa or Vrana Chikitsa. Nothing but a Vrana Chikitsa or Vidradi Chikitsa we can adopt here. But one thing is severe pain is there. So we are giving Manjishtadi Kashaya with the Kaishwara Gugulu or Trifila Gugulu or Gugulu. Manjishtadi Kashaya or Padoradi Kashaya we are prescribing along with the Amadotaram Kashaya. But in the initial stage, actually it need some Vrana Chikitsa. In initial stage, with the hot fermentation, it will, along with internal medication, it will subside due to the increased blood supply like that. Initial stage, very initial stage. But in later, it will become pus and it burst out pus, and then we will do a Vrana Chikitsa like for the Tikta Kashayam, Kaishwara Gugulu like that. And the Nadi Vrana Chikitsa can be adopted here. That is Gugulu Panchabala Churnam we will give morning and evening along with honey. And cleaning that area or dhavana or piju with aragvata toya. In according to Susula, there is pancha kashaya like that or mahavruksha kashaya like that. And then that is aragvata kashaya toya dhavanam. And local application, if it is prana, there is jatyadi hrida lepanam also advised. So a daily approach, not a single sitting. A sitting of 2 or 3 sittings with the patient, we can clearly clear furuncle. In the modern medicine, it is only antibiotic therapy and cleaning is going on. So we can manage a furuncle easily in a OPD with a dosha according to the dosha kashayas, hot fermentation and Abrotram kashayam. Vidradi Chikitsa is beneficial here, furuncle. Okay. The next case is yes, the answer, the right answer. It's a foreign body ear. Foreign body ear. Yes, it's a foreign body ear, and it's a common complaint. Actually, now in my practice in my clinic, within a night time, midnight, a number of cases are coming with foreign bodies. The first one is foreign body. 1 minute. The first one is a foreign body like a material, a hard material like a pearl like that. It is a non-living one, not a living one, a foreign body. But the second one is an insect. It is a living one. So foreign body is of 2 types: living, non-living. Living foreign body and non-living foreign body is there. Okay. How can we manage a foreign body? Actually, it needs some skill. We should have some Ubagaranam. Our Ubagaranam is we have studied Hino Ubagaranam, Vyagram, Avidayam like that. Without Ubagaranam, without machineries, without some probe like that things, we cannot practice ENT. So we should have a kit of minimum instruments our clinical practice. This is an advice to the junior doctors and thousands. We should have a kit. We not only have a stethoscope with us, but also a torch, a minimum probe, BPI apparatus, all the minimum things with us. Otherwise, we can't practice specialty in our clinics. Okay. In the case of non-living foreign body removal is easy by a forceps. It needs some skill. We are commonly using a Hartmann forceps or crocodile forceps to hold it out. And sometimes we all discuss syringing. Syringing is also beneficial in this case, but before syringing like that procedures, we take a history that there is no hole or perforation in the tympanic membrane like that. If tympanic membrane perforation is there, then a syringing causes further movement of the foreign body to the middle ear like that. So a history of perforation like that we should ask. Then syringing, suction can be done. Some paper pieces like that is there. Some children will put some pieces of paper, cotton, pencil, rubber, all these things inside ear canal. We can take it out by suction like that. And in some cases of foreign bodies, microscopic removal is needed. Some penetrated foreign bodies like that, post-oral surgical approach. And along with that, some inflammation will be there. Then we have to use some Shofahara drugs like Punarnavadi, Kashaya like that. Okay. That's in the case of non-living foreign bodies. But what will we do in the case of living foreign bodies? In the case of living foreign bodies, actually foreign body is not a problem. It will keep there. It will stay there for next day, third day like that. But in the case of living foreign body, it's a major problem. It is not the bite of the foreign body, but the only thing is the foreign body, that living foreign body or insect will crawl that area. That will lead to very much nuisance to the patient. So the first intention of the living foreign body is to kill the insect. ആ ഇൻസെക്ടിനെ കൊല്ലുക എന്നുള്ളതാണ് നമ്മുടെ ഫസ്റ്റ് ഇന്റൻഷൻ എന്ന് പറയുന്നത്. So why we can kill the instrument? Only why? As we cannot shoot the insect, we can only we can asphyxiate. So we can instill saline water. In Arogya Rakshal Kalpadruma, the Acharya mentioned Saindhava Jala, Kavoshna Saindhava Jala we can use to instill the ear canal, or any Karnapurna Taila we can instill the ear canal. Then within seconds that instrument, that living parasites, living insect will die. Then tomorrow morning or next day we can remove it out from the clinic with our forceps. Okay, without no attempt should be made with living to catch a living foreign body. Okay, in the living position it is very dangerous to take out a foreign body. That will make very nuisance there. This is the approach in the case of foreign body, living, non-living. Okay, our time is almost 4:20. We can speed the presentation. Yes, this is another case of discharge ear with pain in the case of ear. Can anybody guess the condition? It is
otitis externa.
Yes, it's a type. Yes, it is a type of otitis externa. There is so many otitis externa is there. Localized otitis, we already told it, pharyngeal is a localized otitis externa. Pharyngeal is a localized otitis externa. But some cases it is diffuse otitis. All the ear canal skin is outer canal. All the area of ear canal is inflamed. That is diffuse otitis externa. This is case of eczematous otitis externa. Here, actually some shophum inside there, some secretion also there, so some heaviness also there, and dull pain is also there. So this is actually eczematous otitis externa. Our choice of medicine is actually kafahara chikitsa, kafa shoola chikitsa, kafa vadahara chikitsa we can adopt. Aragudadi kashayam, nimbadi kashayam, padola kadurohiniyadi kashayam we can suggest for patient. But along with that we can daily clear the ear canal, clean the ear canal with the Trifalakwada. And we are internally advising Trifalakwada and some Gomutra Haridagi also. Some people are giving Gomutra Haridagi for Kafhara property, and clear the ear canal, clean the ear canal with the Shrestha Jala. Shrestha means or Vara, that is Trifala. Trifala Jalam, not Trifala Kashayam, Trifala Jalam with honey for cleaning that area. Dhavana purpose. Internally, some medicines like Aragudarishtam and Gadrarishtam. Along with that, we can do Karna Dhubana with the Haridra. Karna Dhubana with the Haridra. And some cases I tried Surasadi Gana Avachurnanam, fine powders of Surasadi Gana sprinkled for some time, then I wipe it out. That is Surasadi Gana Avachurnanam, also tried in the case of otitis externa. One thing is yoga in Sharanandra Samhita, Arka Batradi care, Arka Batradi Thailam is also very effective in the cases automycosis and eczematous otitis externa. Arka Batradi Thailam, in Sahasra Yogam, actually it is explained in the case of skin. Arkapatra Swarasam, Haridra, Kalkam, and Sarshabhadra. 3 ingredients only. Arkapatra Swarasam, Haridra, Kalkam, and Sarshabhadra. Prepare a thaila. It is very useful to wipe the ear canal in the case of some Kafaja Vyadhis, or also in the case of creamy, fungal, like that things in the ear canal. Especially in the case of automycosis, Arkapatra Thailam is very useful, very beneficial in my experience. Another case of diffuse otitis externa. Actually, it is specifically, we can see it is seborrheic otitis externa. Here, no need of explanation. It is associated with seborrheic dermatitis of the scalp. So the treatment is only for the pradhana vyadhi. There is seborrheic dermatitis or darunagam or dandruff. Yes, it is a treatment of seborrheic dermatitis. But ear canal should be cleaned by Araguda Toya and Trafila, Pramajanam Ksharataila. Sometimes we are keeping some oils like Eladi, Surasadi, or Shuddha Durvadi or Durvadi. Eladi Kera, Durvadi Kera, like Kera, we are generally apply and clean that area. Internally, we are trying Nimbasa and Guluchari Kashayam, but there is choice of medicine. This is my choice, but we can select the choice of medicine according to our clinical practice or locality, like that. According to dosha, we can select. It is the freedom of the practitioner. We can select any medicines, but after correct diagnosis, correct assessment of dosha, we can select certain medicines. This is only my suggestion only. Okay. Now, one of the common condition, especially in the case of children, ASOI. I already told the importance of eustachian tube. Eustachian tube is connecting the nasopharynx to the middle ear. If the eustachian tube is only the ventilation of the, actually middle ear needs some ventilation. We are for the BAM students, the full name of actually ASOM means acute suppurative otitis media. Here have an external ear, middle ear, and internal ear. External ear is the canal and up to pinna, and middle ear there is 3 ossicles and that things, and cochlea like that in the internal ear. Okay, 3 parts. The middle ear inflammation, that is related to acute suppurative otitis media, in which the middle ear is connected to the nasopharynx. So the pathology starts in the nasopharynx. See here, due to cold rhinitis or chronic tonsillitis, cough, upper respiratory tract infection like that, inflammation of the tubal end, nasopharyngeal end of eustachian tube happens. There is inflammation of tube, and you know the middle ear needs some aeration always for a proper functioning of middle ear. What happened in the case of nasopharyngeal inflammation? The eustachian tube get locked or it will closed. At the time of inflammation, the mucosa will get there is shofar there and eustachian tube closed. At the same time, the pressure inside the middle ear is become negative and there is some oozing happens. Later, that oozing, that kapha amsha will become paithika and pus. Then the later stage, that pus comes out the external ear through perforation of the tympanic membrane. That is the underlying pathology ASOM. It's a detailed study is needed. It's a chapter for BAMS students. You will read the book. I hope you will read the book. Acute suppurative otitis media, but it's a common cause of ear pain in children in our clinical practice. Remember, it is a common case of ear pain in our clinical practice, acute suppurative otitis media. One thing is important, we should ask the history of cold and rhinitis and just examine for the ear canal and the tympanic membrane status. See, stages of ASM. I told the first a history of acute respiratory tract infection or some nasopharyngeal pathology, then tubal occlusion. Second stage is pre-suppuration, that some pre-suppuration, secretion is there but not pus is formed. Third stage is suppuration, pus filled inside the middle ear, and the fourth one is stage of resolution or complication. The tympanic membrane perforates, pus come out of the middle ear and pain subsides. Sometimes it may lead to complications also. Forced ASOM and its stage is very important for a BMS or an ENT practitioner. Okay. Here we can see 5 pictures of tympanic membrane. Okay. The first picture of tympanic membrane is somewhat congested. Okay. See the pattern of congestion. In the case of tubal blockage, negative pressure inside the middle ear and tympanic membrane starts retraction. At that time, congestion starts and pain starts. In the first picture or second picture, we can see a pattern of a special type of congestion. There's a name in this. What's the name of this type of congestion? Appearance?
Card appearance. Card
Yes.
appearance.
Yes, teacher. Yes, it's cartwheel appearance. Actually, the picture is not much clear, but at the initial stages of ASOM, the congestion is like the in otoscopic examination. It is cartwheel appearance is there. Then the tympanic membrane completely retracts, as in second picture. And third picture, inside the pus and swelling, pus and secretion fill inside the middle ear. It is obvious in the third picture. And in the fourth picture, the retracted tympanic membrane become bulging due to internal collection of pus. Bulging and a pus point is also a pus point is there antero-inferior to the tympanic membrane. There is pus point, and later in the fourth stage itself, like in the fifth picture, perforation of tympanic membrane and pus come out of the middle ear. This is the actually the slides are not much clear with this picture, but this is the for congestion, retraction, filling of middle ear with the pus, and pus come out after a rupture of tympanic membrane. These are the stages of acute suppurative otitis media. So what is our management? It's very important. Acute suppurative otitis media is a common case in our OPD, especially children. We need some expert management in this way. So first we have to arrest the inflammatory conditions by Manjishtadi, or in the case of nasopharyngeal inflammations, Dashamula Gadutrayam Kwada or Manjishtwadi Kwada. If temperature is there, Amrotram Kwada also we are trying. It's very result. It has very result. Okay. Then a Gugulu preparation, a number of Gugulu preparations are available. Not only Gugulu, in the case of children, we can use Gorojradi Guliga, like some anti-inflammatory Mukkadugadi Guliga. In Kerala, we are practicing for Joracna. Actually, Joracna medicine is applicable here. Anti-inflammatory medicines. So, Mukkadugadi Guliga, Gorojradi Guliga, Kaishora Gugulu, other pain-relieving anti-inflammatory medicines we are using in the case of ASM. But the first thing is arresting the pathology. Where the pathology starts at nasopharynx by blocking or by locking the eustachian tube. So we have to open the eustachian tube and clear the air pathway to the middle ear. So to open for a decongestion of nasopharynx and eustachian tube, we have to instill nasal drops. In our classical reference, Acharya explained Dhuma Navana Gandusham. First and ear diseases, Acharya not mentioned medicine, not much Karna Purna. Acharya mentioned Dhuma Navana Gandusha. So clearing nasopharynx is very important in the case of relieving pain in ASOM. So a sudden relief is there. We are instilling nasal drop. If available, we can use. Otherwise, we can prepare a sterile Arka preparation by Surasa Arka, and adding in sterile conditions Saindhava Lavana. Then it will become a good sterile solution for nasal drop. And these nasal drops, 2 drops 3 times per day, or 2 times at the earliest the patient got a relief for the pain. The eustachian tube open and middle ear aeration okay, then pain will subside in the initial stage. Sainthavam for Surasa nasal drops. And along with that, to clear the throat, we have to use a Gandusham with the Kavoshna Saindhava Jalaman Trigadu, Kavoshna Saindhava Jalaman Trigadu, and pain relieving property drugs like Panchayuktam Kashayam, Dargutyadi Kashayam can use according to the availability and stage of dosha, and associated URI treatment can be done. Dhumapanam with Karpuradivarti, not Dhubanam. Dhumapanam with Karpuradivarti is beneficial, slight Dhumapana, not for too much time. And nasopharyngeal smoothness, Thalisadi Churna or Vyoshadi Vadaga can be done. We can use Vyoshadi Vadaga too, not written in this slide. Vyoshadi Vadaga also very useful in the case of ASOM from URI also. Okay, this is the management. The first and prime important thing is clearing nasopharynx and opening of eustachian tube that need a nausea. Nausea means medication through nose. We are using not much nausea procedures, only nasal drops. as a Surasar concern, the winter available saline drops can be used. Okay. Our next condition is actually it is the time is 4:30. A few more slides is there. Actually diagnose the condition. Can anybody diagnose this condition?
Is it Visarpa, sir?
Pardon?
Visarpa.
It's an early stage of perichondritis. Early stage of perichondritis, early stage. Yes, perichondritis, early stage. Okay, inflammation of the cartilage of the or perichondrium of the pinna. Pinna is a cartilaginous. Pinna is a cartilaginous framework. Okay. We studied Pali Rogas. According to Acharya Vakbada, we studied a number of Pali Rogas and especially some inflammatory Pali Rogas also there. And while doing that, we can some Ulpada, a disease Ulpada. Hello, can you hear? Hello?
Yes, sir. Yes, sir.
Okay. Ulpada. Ulpada is a Pali Roga mentioned by Vakbhacharya and inflammation of pinna is there. But my advice is by taking such cases, we are very keen and very care about such cases, because if an injury to the perichondrial cartilage, not perichondrial, if an injury to the cartilage or cartilage is too much involved, then it will be an emergency. Because here the blood vessels are very superficial. An injury to the cartilage is there is chance for gangrene also, extreme painful, maybe complications also. So involved doshavastha, according to doshavastha we can treat, but we should know the complications of perichondritis also. At the same time, if needed, we can use modern principles also according to the opinion of them. Okay, see what we'll do. See, in perichondritis, like acute inflammations, it is very painful, severe painful. A patient cannot touch that area, like Sparshanasa. That area is, you heard about some more diseases like Sparshanasa diseases. In the case of nose, we studied a disease Sparshanasa, which is that disease. In the case of nose, yes, in the case of nose, we studied Dept, a Sparshanasa disease, acute inflammatory swelling of nose, like the vestibulitis, like that. And our cartilage also involved Dept. Here also perichondritis. In such cases, the acute emergency pain relieving combinations, Madrakshadi, Manjishtadi, Kwada, Kaishwaraguru like preparations, Shida Drivya Leba, it is mentioned in Ulpada Chigirsa, Jambru, Amravallava, Yeshti, Lodra, that taking that medicines, making a Kwada and for Sega there, and also applying paste over that area. Beware of sterile conditions without infections. Okay, Shida Drivya Leba and Dhara, and also we can adopt Visarpa Chigirsa. Acharya specially mentioned Visarpa Chigirsa because in Dekta Dosha Pradhana condition, Visarpa Chigirsa. So Grida should be selected, which is having Viredana property also. So Tikta Gridam or Tikta Kashayam, Mahatikta Kashayam, and in the chronic cases we can use Padola the Gridam or Tikta Gridam like that. Tikta Gridam, Tikta Kashayam like medicines. Vidradi and Visarpa Chigirsa adopted, and the early stages easily we can manage, and in acute conditions we can use Jaluga Avirna is also indicated. In the case of acute inflammations of any part of the body, acute inflammation, we can practice Jaluga Avirna. It will give good result. We tried a lot of cases here. In acute cases of perichondritis, we started Jaluga Avirna in certain areas of ear. Not in the area of pinna. We are doing this. This is early stage of early stage of perichondritis. We done the Jaluga Avirna in pre-auricular region or post-auricular region, not in the pinna. But suddenly it changed the color of the pinna quickly. Okay, Jaluga Avirna is a procedure of choice in the case of perichondritis. Okay. And lastly, we discuss about Pudhikarnam, because Acharya mentioned not only Karna Shoola but also Pudhikarnam too, because associated with each pain there is some discharge. Here, see a tympanic membrane. The second one, a perforated tympanic membrane through which pus come out. So a case of discharge ear for 2 to 3 weeks or 3 to 6 weeks, up to 6 weeks discharge ear with a permanent perforated tympanic membrane. It is known as chronic suppurative otitis media. Chronic suppurative otitis media. Already we studied acute suppurative otitis media. In that case, there is acute perforation of tympanic membrane that will heal. But in the case, non-healing perforation is there, and pus discharge, yellow pus discharge, there is no pain at all because this is a chronic case. Pus discharge only and permanent perforation. This is CSOM. Okay. If there is pain in CSOM, if there is pain in CSOM, it's a complication. In the case, if there is pain, it is due to secondary otitis externa. No problem, we can manage secondary otitis externa due to continuous pus discharge through the ear canal. There is secondary otitis externa. We can manage. I already told the eczematous otitis externa, fungal matter. That treatment is adopted here. Can be adopted here. But if there is severe pain around the ear and in the mastoid region, then the CSOM is going to complications. It will change to a complication. We can take a MRI like that, whether it become mastoiditis like that. Okay. Udhi Karna Chikitsa is well explained in our books. So we can adopt Udhi Karna Chikitsa in all the conditions of external and middle ear where there is a pus discharge. Okay. Dhumanavana Gandusham, Karna Dhavanam, Karna Pramarjanam, Karna Dhumanam, Nasyam, and medicine for all these purposes are well explained by Acharya. And also Acharya mentioned Shringena Abahare Dhiman Davabi Shalakya. If pus in the middle ear or pus in the external ear can be abaharid, shrinkena. So I already explained, by suction we can clear the ear canal pus like that, or shalaga, with a probe we can clear the ear canal with the help of a cotton. For ear toilet, in the case of CSIM, ear toileting or dry mopping or suction is the pramarjanam with the ksharadaila, karna dhavanam with araguda or surasadi toyam, karna dhuban with gugulu, Pijuvarti with Surasadi I already mentioned, and here it is typically a type of Nadi Prana because pus collection, then pus comes out through a perforation. So here Nadi Prana Chikitsa is very apt. So we can try Gugulu Panchabala Churna like that medicines. Gugulu Panchabala Churnam, tablet form 2 tablet BD for 5 days, Churna form 5 gram Churna BD with honey into 5 days. Okay. This is the primary approach towards CSOM, but there is a due to the permanent perforation is there, so a conductive deafness also there. Yes, Panchadiktaga Gulitam, Padoradi Kashayam, Ugulu Panjola Churnam, Kaishwara Ugulu. In some cases, chronic cases, we are giving Madhusnuhi also. Madhusnuhi is also we are giving. It is available in Trivandrum as Gugulu Madhusnuhi form. We are giving 1 teaspoon BD. In chronic cases, Snehabana with after Ama stage, we are giving Snehabana with Padola Niguda and Tikshna Nasya. Tikshna, Vireda Nasya, we are doing with Surasa and Sainthava like that. Churna Nasya also we are doing. And Shiro Abhyanga with in chronic cases, we are doing Shiro Abhyanga. We are Murtha Daila with Asana Vilwadi, Vajarishnadi, Asana Manchistadi like Shiro Abhyanga Tailas. Okay. These are the common conditions of ear that will lead to pain and associated complaints. We've in the last few slides, we discussed the importance of clinical knowledge. Second, we explained some instruments. Then we go to the symptomatology and some conditions in which pain is there with differential diagnosis. At last, we discussed common conditions of ear canal and its management. And this is the last slide. Thank you all. Thank you. Hello, can you hear me?
Yes, sir. Yes, sir.
Okay, thank you.
Sir.
Okay.
Thank you, sir.
Okay.
Thank you, sir, for such an interesting, well-explained, informative session, sir. So we have few minutes for interaction. So we have one question in the chat box. Can you explain the management of Karna Nada?
Okay. Actually, the question is, I already told in the case of ear diseases. Actually, that is my topic for PhD also, Karna Nada. We have 3 group of diseases in the case of ear. One is pain dominating cases. Second one, pus discharge cause is the main feature. Third one is Nada Badhirya Ksheda, like that thing. Nada Badhirya Ksheda management. In the case of Karna Nada, actually there's a lot of causes. Actually, Karna Nada is a broad symptom. Karna Nada. If the patient has an HB, follow of HB also there's Karna Nada or Karna Ksheda is there. And in whatever may be, general approach Karna Nada in Trivandra, whatever may be the pathology, we got good relief in an IP management with the Snehapana. Here we are practicing Snehapana with the Rasna Dashamula Grita. In the Rasna Dashamula Grita Snehapana, along with that, Nasya and Shirodhara, we are using Eranda Shigradi Taila, a famous combination now in Ashtanga Hridaya, Eranda Shigradi Taila, Shiro Abhyanga and Nasya. We both, for both purposes, we are using Eranda Shigradi Taila. Master Nasya with Eranda Shigradi Taila, and 7 days Shirovasti or Shirodhara with Eranda Shigradi Taila. Internally, we are using this Rasna Dashamula, and also we are giving some medicines like Vadavyadi Chikitsa also we can adopt here. Some cases Vadic involvement is there, so Vadavyadi, Kshiradhumam and Ardha Chilsa, Nasyam, Dhanadayadi, Ashtamgam Kashayam, like that we are trying. So a Vada predominant degenerative conditions like that we are giving this much medicines. If any inflammatory diseases are due to labyrinthitis like conditions, we are adopting Kapapitta Shamana Chilsa. So Shirabala Nasya and Asana Manjashtadi Kara Thailand Dhara like that. So Tikta Padoladi Guda internally. If they like Meniere's disease like that, if some patients are coming here with Meniere's disease like that, having Karna, we are trying with the Padoladi Guda plus Rasna Dashamula Guda internally as Snehavana or Avipetaka Snehavana, and Nasya with the Eranda Shigradi or Shirabala. If Pitta dominance is the Shirabala, and Shirodhara definitely with the in the case Asana Manjashtadi Kara. Not Kapapitta dominance is Asana Villadi or Asana Manjashtadi Kara, and internally we are giving Pathya Shadagan Kashayam like that. So Shirovasti, in the case of chronic cases of Shiro in the Karna like that, we are giving an IP management with the Nasya and Dhara, and according to dosha we are selecting the medicines. Okay. Okay, doctor.
Okay, sir. Next. In automycosis, can we do suction in the first sitting itself?
No. Actually, automycosis actually, whatever may be the practitioner is very much, if he is very much expert, then after practitioner expert if we are not much trained or very trained, whatever may be the condition, it needs 3 to 4 sittings. In the first sitting itself, we can take out some part only. Then up to tympanic membrane, there are some secretions like that, the thick, creamy, white discharge, near the tympanic membrane also. So 1 or 2 sittings, or minimum 3 sittings are needed to complete suction for the suction of the discharge in the case of automycosis. Also, not only suction, after suction, sometimes we are wiping the area with the cotton and bud like that, wiping also that area. And some after suction, some debris may be there. Then we again do syringing, then again suction. So suction clearance, wiping, permajanam, a combination of this is needed to 2 or 3 times along with internal medication is needed for management of automycosis. Okay.
So another question we have is, please do explain Surasadi Phanidam.
Yes, Surasadi Phanidam is a combination that we are using in. Actually, I think many of you are aware of that thing, Surasadi Phanidam. Actually, that is not a separate medicine. We are using Surasadi Gana of Ashtanga Hridaya. Surasa Yukapadincham, a yogam is there. Surasadi Gana. It is a Kapashamana, Krimishamana, Kapaharattum, Krimiharattum. Both are there. Kapahara, Krimihara Yogam, Surasadi Gana in Ashtanga Hridayam. That Surasadi Gana available, Surasadi Gana test we are taking, and simply like Kashaya Kalpana, we are making a Kwada. After the Kwada is prepared, that content removed, then the liquid portion, again we heat to condense. After condensing that portion, we are taking out. After cooling, we add some honey and keep it in the our surgical theater. And then Surasadi Phanidam as a in the use of a ear packing forceps. Then we are not using cotton, we are using gauze for that. With the gauze, we are making a varti, and applying this Phanidam on the one end of the pijuvarti and insert this pijuvarti. It is not like that nasal packing. Actually, nasal packing is different. Nasal packing we are doing in the case of epistaxis is fold by fold packing, anterior nasal packing in the case of nose. But in the case of air, yes, there is not much packing is there. We are inserting a pijuvarti. That varti, all over the varti, we are applying that Surasadi Phanidam up to an extent. Then insert that piju to up to 2 20, that's actually it is 24 millimeter. So approximately at that extent, we are inserting that Bijumon to the ear canal, and we are removing that after 2 hours. We are removing that more early morning and evening. We are keeping that Varti in the ear canal, not much time. As I mentioned, though Kalo Bijumon 2 times a day. 2 times we are applying Bijumon in the ear canal, 2 5 days. But after that, all in my practice, in all procedures of ear, and whether it is Karna Purana, Bijumon application, Karna Pramajana, Dhavana, finally I will wipe that ear canal with a dry cotton like that thing. Otherwise, if there is any water content in this medicine, there's a chance for some other pathologies. So Acharya mentioned some special tailas inside the ear, because in Navana Purana Abhyanga, that's not a Paga of Thaila, Chikkana Paga, Manta Paga, like that. For water, if there is a water content in Thaila or medication we are using, then there may be some again fungal growth is there. So whatever may be the procedure in the ear canal, after that we will wipe that ear canal and clear it and ensure with otoscope that there is no water, no other foreign body like that. This is we are doing in a Surasadi Pandita application in the case of not only automycosis, but almost all cases of Pudi Karna we are using Surasadi Pandita to clear that area and to reduce that sofa, to reduce that inflammation there. Okay, doctor. Okay.
Sir, another question. How can we manage tympanic membrane perforations with complete cure through Ayurveda?
Okay, it's an interesting question. Actually, tympanic perforation. Actually, in my practice, there are three different cases. One is acute perforations, and like some crackers, some blast like that thing. There is a perforation tympanic membrane is there. Acute perforation due to a blast in the festival season. There's a cracker, some burst is there, and from the hand, and some perforation is there. It's acute. Actually, it is acute tear. A tear of tympanic membrane is there. A little tear is there. I have given only the medicine like Amrotharam, Pranamadi, Kaisharopudu like that, but no any medicine applied inside the ear. The management of acute perforation of tympanic external cause is plugging the ear with cotton, or keep the ear dry and avoid any respiratory tract infection like that. So it will naturally heal. Some extent of complete destruction, it's very possible. Reconstruction is needed with the bone rearrangement like that. But primary minute perforations and some minimal tear, we can keep the ear dry. No medication inside the ear. You can keep if there is cold wind like that, keep the ear canal dry. But internal medication for the anti-inflammatory medicine inside, and clear the throat for avoid sneezing like that. If sneeze is there, patient also that the healing process reverse itself. So clear throat, avoid respiratory infections, anti-inflammatory analgesic medicines are given. Clear the ear, keep the ear clean, and no installation of any medicine in the acute perforation stage. And the second type of case is ASOM. In ASOM cases, if the third stage, the last stage, tympanic membrane perforation is there and pus come out. At that time, there's central anteroinferiorly, there's a perforation, pus come out. If immediately after 1 week, within 1 week, we are giving proper drainage, proper suction of the pus, and giving anti-inflammatory medicine within 3 to 4 weeks, the membrane become united and healing of tympanic membrane is there. Internally, we are giving some medicines also. In ASOM also, there will be gradual, there is a healing of tympanic membrane perforation, ASOM also. But in the case of CSOM, if CSOM is there, especially in the case of unsafe otitis media like that, in the case of CSOM, it's very difficult to heal the perforation, because after chronic exposure to actually, the ear canal is, tympanic membrane is actually 3 layers: outer skin, middle fibrous, and inner mucous membrane. And so that skin is continuous to the ear canal itself. So if there is a hole for tympanic perforation for a long time, then epithelialization happens there. The skin changes are there in the margins of the perforation. Then it will not unite like that. Then it need a surgical correction. And in Trivandrum, in our area, Ayurvedic people not dealing with the ear surgeries. So if there is a surgical correction is needed in the case of large perforations and chronic suppurative otitis media like that conditions. Otherwise, acute perforation and ASOM cases and the small perforations, some injury like that, we are doing well managing. Internal medications and anti-inflammatory drugs are sufficient for managing such cases. Okay, doctor. Okay.
Thank you, sir. Another question. what is your treatment experience about sensory neural deafness?
Okay. Sensory neural hearing, doctor, sensory neural hearing loss alle, doctor? Sensory neural hearing loss allarno choichada?
Yes, sir. Yes.
Yes, sensory neural hearing loss. Actually, in our colleges, especially in Kerala, many people dealing with the sensory neural hearing loss treatment. And in Trivandrum, in my college, I have audiometry, middle examination techniques. All the things are here because postgraduate department here we have postgraduate department. All the missionaries are here. And we are assessing all the changes time to time and scoring all that things. Many studies are going on, but in the case of sensory neural hearing lossing, we are I will certain things I already explained along with the tinnitus. Already told that what is the treatment of tinnitus, and in our classics, Nada Badirya shoola, a common pattern of treatment is there. That shoola means not the inflammatory change. Vada predominant shoola, Nada and Badirya have same mode of approachment. In same mode of approach. And in the case of Badirya, there is not much inflammation like that. If there is a conductive dose, we have to remove that blockage. But in sensory neural hearing loss, there is no deafness, no blockage is there. Only in the higher center, there is sensory apparatus or neural apparatus damage. So typically, Vata Hara Chikitsa is we are taking. We have already told, we have a Snehapana with sometimes Kaphanibandham is there. So Induganda Grudam we are using, or Asna Dashumara Grudam we are using for Snehapana. The Snehapana is in the Achapana. Patient with the proper hungry and no amavastha, then Snehapana with the Induganda Gruda or Asna Dashumara Gruda like Vata Kapha treatment. Then sometimes we are changing the Gruda to Vidaryadi Gruda like that, so complete Vata Shamana property Grudas. Then after a Virajana with the Gandhar Veranda, we are using Gandhar Veranda Virajana. Next, we are moving to Nasya with Dhanundram Thaila. Nasya with Dhanundram 41 or 101 Avarti Thaila. Dhanundram Avarti Thaila Nasya, or mixing with the Eranda Shigruadi. I also mentioned that if Kapamsha is there, Eranda Shigruadi Nasya also beneficial. Then after Nasya of 7 days, keep the patient prepare the patient for Shiro Vasti or Shiro Dhara with the plain Dhanundram Thailam or Eranda Shigruadi Thailam. Along with that, we are applying one more thing we are doing is for increasing the perfusion to the area of the labyrinth, all that area, we are doing Jalugavarnam also. In Karna Pagaranam, Ajari mentioned Edo Suptha Viva, Jalugavarnam also advised. So after Snehapana, we are doing Jalugavarna also around the year, especially in the Karna Mula. Karna Mula, we are Jalugavarna also we are doing. And I also tried some Agniarma procedure also in this context in around the Pinna area for the case, but it's not much result I can score. And this is the approach. Vada Pradhana or Vada Kapha dominant Shamana Chikitsa we are adopting. Dhanandram Thailam Shirodhara or Eranda Shirodhara, Nasim with Dhanandram Thailam, and our Achapanam or our Peta Sehavanam with Induganda Gada or any Vada dominant Vidaryadi Gada like that. This is the mode of approach, and more up to moderate sensory neural hearing loss we can control some, so especially hearing loss associated with Meniere's disease and below the age of 60 years and familial progressive hearing loss I can manage better when I am continuing my study. Actually, I already told my topic of PhD is this thing, so I am going with this sensory neural hearing loss like that. One more thing is, actually hearing loss means not only decrease the hearing ability, but also that certain type of hearing loss that patient has lost the speech discrimination power also. Patient can hear the thing, but he cannot discriminate the speech. That's one of the major problem for deaf patients. His speech discrimination is reduced. He can identify, he hear the noise, but can differentiate. But after a Shirodhara with these medicines, his discrimination will increase. He can differentiate all the words separately. So not only Bhadiryam, but also the speech discrimination will increase after a course of Ayurveda treatment. That's my experience. Okay, doctor. Okay. Okay. Okay, doctor.
Sir, we have another question. Like
Yes.
Like perichondritis cartilage injury, what are the other cases in which we should refer the patient to allopathy emergency department?
Okay. Allopathy. Yes, I already told in perichondritis, there is some infection. Sometimes inflammation leads to perichondrium. That means cartilage. If cartilage is involved, it is very important to know that because we can do what we studied. We have limitations, and if there is involvement of the cartilage, then this next step is gangrene and total loss of the pinna and deformation of pinna. It is very crucial because the young child, a girl child, a woman, and adolescent people, there is cosmetic problems also there and severe pain. Even the infection may lead to higher centers and pain like that. So definitely perichondritis, we have to stage-wise treatment important, and if cartilage involved, we have to refer. One other cause is in the case of CSOM. In CSOM cases, if there is foul smelling discharge, continuous foul smelling discharge from the ear, we are treating CSOM. There is no fever. Sometimes there is the discharge and sometimes the predisposition. And how much long the course, we can go with the patient. But if there is pain in CSOM and the discharge become foul smell, thick and purulent, stringy, thick purulent discharge from the ear with foul smell, then it is the sign of cholesteatoma. Cholesteatoma means a condition along with the skin in the abdominal space. Cholesteatoma is a condition where there is bone erosion also there. Because in chronic cases of CSOM, sometimes the unsafe otitis media, the mastoid is involved, and the facial nerve also involved, because in the middle ear, the posterior wall, there is facial nerve is there. Sometimes the cholesteatoma form due to chronic CSOM. Cholesteatoma forms, bone eroded, total destruction is there, facial nerve injury is there, bone eroding, so foul smelling discharge. Such cases also, if cholesteatoma formed and middle ear, mastoid involved, then definitely that needs some modern intervention like IV antibiotic like that. Otherwise, next step is the infection going to the internal auditory meatus. Next step is to brain and meningitis. That urgent MRI needed and urgent intervention needed. So we have to identify the Kriya Kala or pathogenesis of the disease. If we can manage, we can do. Otherwise, identify the pathology on stage. Then if we can manage. Otherwise, we can to refer the patient. So cholesteatoma is another case we have to refer, and another case is perichondritis like that. Then some malignancies all we can refer. Some malignancies that Shalakyatantra people can manage. I don't know details about all the malignancies of ear canal, and some injuries like that. Sometimes some bleeding like that. If actually I know some injuries on the road traffic accident like that. Some injuries of petrous bone fracture is very important. Some fractures of petrous bone, some definitely bleeding like that from the external auditory canal, and that cases also, or floor of the cranium, some fractures of floor of cranium. Then there may be CSF otorrhea. In previous slide I explained CSF rhinorrhea and CSF otorrhea. If there is a dehiscence or a fracture of the floor of the cranium, then CSF will come out like a flush of water. In the case of CSF rhinorrhea, if patient lean forwards, there is flush of water from the nose, and the patient, if we doubt it is a rhinitis like that, but the patient cannot sniff back it. So that's a flush of water. It is CSF rhinorrhea, like a flush of water, flush of discharge, or discharge from the clear discharge from the CSF otorrhea. That case also, there is a pathway to the brain, and CSF otorrhea or in bleeding from the ear, predominantly due to an injury, we can refer the patient to a higher center. That's all. Okay, doctor. Okay.
Sir, last question. How can we remove a living foreign body in a patient having tympanic perforation?
Okay. In the case of tympanic membrane perforation, I am using saline solution itself. Actually, saline solution, not oils like that. I am using. Actually, modern people are using chloroform solutions like that, but we are using in Trivandrum, or I am practicing in my clinic, that saline solution. Saline solution is not creating not much problem in middle ear like that. So I am instilling saline water, prepared Sainthava prepared saline water. Sainthava is not not making damage to middle ear like that. So putting saline water to the ear canal for a period, and next after the creature is not live, then I will take out the creature with the foreign body or crocodile forceps. Saline water is using for killing that creature. Okay, doctor. Okay.
Thank you, sir. So moving on to our concluding session, I invite our finalist student Shruti to deliver the vote of thanks. Shruti? Sorry, I think she is not online. So I take this opportunity to first of all thank our guest speaker, Dr. Bijumon O C sir, for delivering such an interesting, very informative, very interactive session with us, sir. On behalf of the Association of Shalakya Kerala Chapter and the Dept of Shalakyatantra Ashtamgam Vidyapeedham, I wholeheartedly thank you, sir, for accepting our invitation. Then I extend my gratitude to Professor Dr. Gina and J. Madam for accepting our invitation and being with us as the guest of honor in today's session. On behalf of the Department of Shalakyatantra Ashtamgam Vidyapeedham. And I also extend my gratitude to our HOD, Vaidyan Prasad sir, my colleague Vaidya Ashwin, and my all dear students for their support for conducting this Shalakyasiddhi series. Last but not least, I extend my gratitude to all the participants for being with us. So thank you, thanks a lot. So we are winding up the session. Thank you, sir.